It's a huge pleasure, as always, to be here and taking part in such an important debate. And hats off to TSA, as always, for challenging us, making us think, and helping us to work together. I'm going to share my own Celtic Manor tale, which is that I too have been here before. I was born 2 miles away, and in the old manor house here, which forms part of the Celtic Manor Resort, my baby brother was born because it was then the Lydia Bainin Maternity Hospital, and I came with my dad to bring him home. So, slightly different tale, but it means something to me nonetheless. For those of you who don't know Carers UK, we're a charity which has been lobbying, campaigning, and providing help for 50 years now for carers. That's family members, friends, or neighbours, providing support for a loved one who is sick, older, or disabled. But we are a charity, and these are tight times for the third sector. This year, the sector received less funding from government, including local government, than it did from grant-making trusts and foundations. And there is a heck of a lot more competition, too, for that funding. So, we live in a world, as do all public services, of changing funding priorities. We feel it's our responsibility as a charity supporting the wider population to step up to that challenge in the way that we actually deliver our support. The National Council for Voluntary Organisations recently said that trusts and foundations must consider where their financial interventions can make the biggest difference to the future sustainability of the third sector, and invest in the infrastructure of voluntary organisations so that they can change their operating models and do things differently and indeed more cheaply in the future, a challenge for us all. But they also said that there's a danger that more funding for core costs in response to this changing environment would mean a lot less funding for innovation. So, the challenge lies in innovating to achieve both cost effectiveness and service enhancement, and it lies challenges as much for us as it is for providers, suppliers, industry, public and private sector. We need a new infrastructure that has to go alongside new ways of working and cultural flexibilities. We know that the effective use of technology is fundamental to this change, but it's not the whole picture. The wrong attitude to change can sink the ship. And one of my takeaways from yesterday is Paul's statement that culture eats strategy for breakfast. The challenge for Carers UK is to respond to the innovation challenge facing it to achieve cost economies and operational effectiveness, whilst also enhancing service provision. And it's a challenge, as I said, as much for us as it is for any other organisation. Our key driver is our charitable mission, and that is quite simply to make life better for carers. Caring is not a niche issue, it's about you and me. There are 6.5 million carers in the UK today. Ray's figure was for England only. That's 1 in 8 adults, and we've just recalculated the contribution to the social economy of what carers do on a daily basis. It's gone up from 119 billion, our old figure, to 132 billion, and I recently heard Baroness Jill Pitt-Keithley, who's one of our greatest advocates and campaigners, say on a public stage, use this figure on every platform, whoever you're talking to. So there it is, 132 billion, almost the equivalent of an NHS. And 3 million of those carers combine paid work with care, 1 in 9 in any workplace. So this is you and me in this room doing this stuff, currently juggling care with work, other family responsibilities, and doing that in increasingly complex and tight times. We care because we want to. It's part of the fabric of our everyday lives. It's part of a human condition. But when it's not supported, caring can have really negative impacts. Impacts on our ability to work, impacts on our health and well-being, impacts on our ability to save for our retirement, to save for our future, indeed to save for our own care costs. And so, what has been our organisational response to this? And we are merely, one case study in a sector struggling to come to terms with the need to work differently. We've invested in our own technology infrastructure. We need to ensure that our own website, for example, is fit for purpose, to ensure that all our functions can be integrated and delivered seamlessly. Our information and advice service now uses video and e-learning, Facebook and web chat. We have a team of volunteers who offer a listening ear service remotely from their own homes as part of our national advice line. We have related support sites, for example, Employers for Carers, which is a web-based membership service for employers who are seeking to develop workplace policies and practices, and through which we've helped organisations like the London Fire Brigade develop virtual carer networks to support their operational frontline staff who so very often can't click into their existing technology support. We've also invested in technology-enabled products and services ourselves. We've brought our capacity to develop things like e-learning in-house so that we can deliver blended training solutions that include e-learning, that include webinars. We developed an online hub that connects and supports our growing army, now of over 350 volunteers. We've developed and brought to market, I'm proud to say, our very own care coordination app jointly, slightly more about that later. But critically, we've done this while ensuring our own integrated data infrastructure. We understand more about how we have to integrate data across all our own functions, but also across the functions of other organisations. We're making much more effective use of web and data analytics to develop and promote our products and services. But above all, we have driven a cultural shift towards cross-team collaboration, multiple roles and upskilling in-house, a do-it-here approach. I'm going to share one of our service innovations, which is a digital offer for carers. It includes Jointly. Jointly is an innovative mobile and online app, and its claim is that it simply makes sharing care with others easier, less stressful, and a lot more organised, and it's designed for families, groups of people who are caring for someone who sits in the middle of a circle of care. It's a digital tool. It's not for everyone, but it will increasingly be used by those with access to a smartphone, a PC, laptop or tablet. It includes About Me, Building Resilience for Caring. It's an online resource, an e-learning resource that helps carers identify and build networks of support and promotes their own self-care. A few shots of it here. It includes our Upfront Guide to Caring, and the Upfront Guide to Caring is really a very, very simple online assessment tool that enables anyone visiting our own website to be directed to specific sections of the site for information that's relevant to their own situation, and then it produces a short action plan to help them plan next steps. And it is simply a way of curating information. It's helping people either new to caring or seeking help for the first time, because people very often don't recognise the fact they're caring until quite far down the line, to find information quickly and easily and to receive additional signposting to support. And it simply takes you through a very simple questionnaire, directs you to the relevant parts of the site, and then creates an action plan for you. About Tom, that's my Tom, and I recently completed the Upfront Guide myself, and very useful it was too. And finally, Being Heard, a self-advocacy guide for carers. Being Heard is an online toolkit which provides information and techniques to help people advocate for themselves, and increasingly this is about self-help. And here it has a core guide, and this links to a range of satellite resources which give carers access to more detailed information. So, this is exceptionally simple in itself, and you could say as an innovation it's a pretty straightforward one. What we feel really is innovative, though, is in the value add for the local authorities, the CCGs, the employers who are rolling out the digital offer, in the ability to use data to track outcomes. They will have a tailored landing page for their exclusive use that enables them to co-brand this offer for carers, that will add their own links to the page, giving carers access to local information which, as we know now, is part of the duties of Care Act 2014, and an exceptional challenge for local authorities in that it reaches beyond people not known to services. Employers could roll it out in a similar way to give people information about workplace support, but it will also give them access to data about how many carers are actually using these resources and what impact they've had from feedback mechanisms buried inside these, embedded in these tools. And that will enable them to monitor outcomes and target support more effectively in the future, to understand how these digital tools work and how they can be developed. The digital offer can be rolled out to carers through any local information point, through a library, a leisure centre, a supermarket, but also through a GP practice and through a workplace, helping to reach people who might not identify themselves as carers, and we know that this is a real challenge. We have confidence that these service innovations will make carers' lives that little bit easier, because we've asked carers what they want and we've involved them in product and service design. Too often, products and services are developed for users and carers, not with them, and we're increasingly using a range of methods to engage carers, including research, our own annual State of Caring, for example, but we regularly conduct research through our Employers for Carers Forum to ask carers what it is that makes their lives easier. Through feedback mechanisms that we embed in existing products and services, through member surveys and events. We have our annual summit next week, and we use that as an opportunity to get carers' feedback on the ground. But also now through a growing group of what we call research volunteers. We connect these volunteers through our volunteer hub. We engage them, we support them, we keep them in contact with us, but we also keep them in contact with each other. And we use them to conduct surveys, interviews, either telephone or face-to-face, focus groups, and indeed co-design workshops. And we can use this resource not only for our own products and services, but for those of other developers and providers, so that we have that carer input, that carer voice, that carer feedback when we are developing things that make their lives easier. But if we are to achieve the longer-term goal of making digital business as usual, we must also involve carers in policy and campaigning. Technology-enabled services are increasingly the way the third sector does business, as well as all other sectors, and we have to be part of the policy debate on techs to ensure that they're fit for purpose and reach the people who can benefit from them most. The user and carer voice is the most powerful validation of third sector participation. Carers UK carries this voice into its work with government and government agencies, its partnerships with industry and commerce, and relationships with other charities. And tech is increasingly a key topic for our own awareness activities, such as Carers Week and Carers Rights Day. But we have a significant new opportunity now to ensure that techs are embedded in the support that families can expect from government and from the public sector. Jeremy Hunt announced a new national carers strategy in July, and Carers UK is working hard to ensure that at the core of that strategy is a recognition of the way that technology can make life better, not only for disabled, older, or sick people, but for their carers. We will continue to innovate for change, and we'll work with others doing the same. That's all of you in this room. And together we will indeed nurture and promote ideas that create, as Ivan Evans said yesterday, not only invoices, but create value. Thanks very much.